The overall goal of this method is to acquire retinal images using a smartphone camera.
This method facilitates the recording of ocular fundus images using a smartphone camera and a conventional handheld high-plus power ophthalmoscopy lens.
Really, the main advantage of this technique is the widespread nature of smartphones, allowing us to capture optic nerve and macula pathology outside of the clinic.
With increasing availability of smartphones and the expansion of telemedicine, this method can be adapted by ophthalmologists and optometrists to document retinal pathologies in emergency room setting and telemedicine consultation for retinal diseases. In addition, healthcare providers may find this method handy in developing countries and in medical aid camps during a disaster rescue operation. Before beginning the imaging, explain the procedure to the patient. After obtaining permission, deliver 2 different mydriatic drops 2 to 3 minutes apart to the eye that will be examined. Wait 15 to 20 minutes for the pupil to dilate. Then, ask the patient to look at a far target with the other eye and set the smartphone camera to video mode. Turn on the smartphone flashlight. Then, cover the light with semi-transparent tape and darken the room. Sit 30 to 60 centimeters in front of the patient on a comfortable chair at about the same level as the patient, and press the camera record button to record a continuous video. Using the thumb and index finger, hold an indirect ophthalmoscopy lens in front of